So we are in Canada, Australia, and the United States, and we hit 15 viewers, which means I am going to get underway. This is the hidden secrets to reducing your sciatica pain to zero. And my name is Dean Volk, for those of you who don't know me. So for you to succeed with this class, I'm going to ask you to do a few things for me. Number one, grab a pen and paper so you can take notes by hand, because I've learned that when you write handwritten notes to yourself, things stick a lot better than if you're just taking notes on a computer. Number two, I'm going to ask that you ask questions. The more questions you ask, the more you will learn. And also I'm going to ask you to please put your phone away. Make sure that you have zero distractions. All right? What is my big secret? In order for you to understand my big secret, first we need to understand how pain works. So what I'm going to do is I'm going to give a brief overview of how pain works so you can understand why what I do is so important and so much more effective than what you've been going through right now. Your pain is basically constructed entirely inside your brain. That does not mean you're a head case. That does not mean you are not feeling anything, but it doesn't mean that your pain is any less real than what you feel. It's just that your brain literally creates what your body feels, and in cases of chronic pain, your brain may actually perpetuate that pain. Sort of think of the brain as an alarm system. The brain sounds the alarm signals of pain, not only because it perceives a threat physically to your body, but it can also perceive psychological and emotional threats. The body doesn't really know how to differentiate between a physical and a psychological or emotional pain, and both emotional and physical pain are interpreted in the same overlapping regions of the brain, typically called the amygdala. So let me ask you this. Has stress been a big factor in your life? And if you can please just put in the comment section yes or no, or if you want to share what the stresses have been. Has stress been a big factor in your life personally? If you can just comment for me, you can put your pens down and start typing in the comment section yes or no. Vikas says yes. That's what I thought. For most people, somewhat. For most people, stress, some level of stress, whether it be emotional, physical, financial, relational, stress has played a factor in people's lives. So thank you for answering all this. So what I'm here to tell you is that most pain in most people's lives is not your fault. And I hope that's relieving to hear, because many people who have had experienced any type of stress, anxiety, trauma, PTSD, and depression often suffer with chronic pain in their life. Any type of adverse experience in your life can create a perfect storm for pain, and oftentimes it turns into chronic pain. And let me explain a little bit. Studies have been done that have shown that children who've experienced any type of stress in their early childhood, even whether it be parent separation, a divorce, some type of emotional trauma, verbal, physical, sometimes sadly sexual abuse, any type of stress in a child's life can play a huge role in their future in the form of pain. Many times, and many studies are proving that people who suffer from chronic pain, no matter whether it's sciatica, no matter whether it's like a fibromyalgia or any of these other autoimmune types of diseases, there's a lot of studies out to show that there's a huge emotional part that plays in chronic pain. And what's amazing is the area of your brain, like I talked about earlier, that interprets your emotions also interprets the pain that you feel. So it overlaps. So emotional pain, stress, anxiety, fear, all those things can actually magnify the physical pain that you're actually feeling. It doesn't mean that the pain is not there, but those type of emotional traumatic things have a definite impact on your pain. So many people are asked, why am I not recovering? And let me just tell you that brain memory and brain pain, emotional connection can be playing a big part in not being able to overcome sciatica. Many doctors and physiotherapists overlook this entirely and just simply treat the symptom of pain. That's not a bad thing because, hey, everybody wants to be out of pain, but if you're not looking at the body as a whole, if you're not looking at the brain patterns, if you're not looking at emotional sides of pain and psychological sides of pain, you're missing a big point. So when you're looking at just the physical aspect of pain, this is causing their patients to run into an endless cycle, wondering why they can't fully recover from sciatica. Tell me if this sounds familiar to you. Have you heard this before? Let's just wait a few weeks and see if the pain goes down. Take these medications. I'm sure they'll help you with pain. Or a lot of times it's, hey, let's take these pain medications or anti-inflammatories or muscle relaxers for a couple weeks. Come back and tell me how you're feeling. Or here's a sheet of exercises you can do for your pain. Or apply some ice or heat or TENS and you should feel better. I'm assuming that most of you have heard these things over and over and over. So many times, do you notice how the pain always comes back after you do these things that the doctor and the physio tells you? And shockingly, nothing has really changed after you get handed some exercises or you try the medications again or you get the injections over and over. This is due to one thing, that those who are treating you only understand how to give temporary relief and not solve the core issue. And I see many of you are saying, yep, big yes. This is what you've heard over and over and over again. So Dean, what do I do? That's the question I get asked all the time. Or people say, Dean, what exercises are going to help with this? Or Dean, just tell me the exercise to do. And if it were that simple, I would be able to help everybody in a snap of a finger, but it's not that simple. So how do you live a life without consistent daily pain? Here are the 4 steps that I use with each of my clients, and each of my clients is actually different in the way that they go about this. But here are the 4 steps. Number 1, you need to learn your triggers so that you can avoid them or learn to perform those movements, positions, activities that trigger you in a different way. And you also need to learn your emotional triggers as well. I remember a story from a person when they were adult. They started telling a story about how when they were a child, their parents' neighbor came over and said, your kid throws a lot of fits. You want to know how to stop it? Take this water bottle, and when they start throwing a fit and start crying and screaming, squirt them in the face with the water and they will stop right away. And guess what? The child did. The child stopped right away. And now this child is an adult, and he was telling his therapist that anytime something comes up that's emotional, I close up right away because as a child I was squirted in the face, I hated it, and they had all this pent up emotional stress, tension, anxiety inside because they weren't allowed to let it out. So that's what I mean by your emotional triggers. Number 2, so after you learn your triggers and you learn to avoid them or you learn how to work around them, number 2, we teach you how to find your specific imbalances physically and fix them. We need to teach you how to specifically find your imbalances, and your imbalances are probably going to be different from anybody else's imbalances because your body responds in a way that you've been trained, in the way that you've learned, and in the way that has worked for you. And then once we find those imbalances, we fix them so your body's more balanced. Number 3, once you're balanced and having significantly less pain, we want to stabilize your body in a balanced position to help avoid future issues. Okay? So, first, you got to learn your triggers so you can know what to do to avoid them. Secondly, you need to learn your specific body's imbalances so that you can fix them. Third, once you're balanced and have significantly less pain, then you want to stabilize yourself in this balanced position so that you can avoid future flare-ups. And finally, you want to slowly return to your normal activities in a controlled way, not all out, hey, let's get it all done right away, because we don't want you aggravating or re-injuring yourself again. Does that all make sense? Does that all make sense? And do those 4 steps sound like anything of what you have been doing already? Have you been learning your triggers and avoiding them both physically and emotionally? Have you been teaching yourself, or have you been taught how to find your imbalances? Have you been able to balance out your body and then stabilize yourself while you're in a balanced position? Can you guys just write down for me in the comment section, is this something that you guys have gone through? Have you learned these things? Here's what I'm looking at. These 4 steps are critical for long-term healing. And if you're not getting these 4 steps in your rehab, in your treatments, you are not getting what you deserve and what you need. So moving right along, thank you guys for following along and listening. So are you finally ready to live pain-free? If you are, I want to get together with you and understand your pain personally. I know many doctors don't care, or most of the time they don't have adequate time to spend with you because most are overworked and see way too many patients a day. But I want to sit down with you and create a custom plan to help you live your pain-free life as soon as possible. I can't help everyone, so here's what I want to offer you. Here's how to fast track your results. Number 1, we need to understand exactly what kind of treatments you have tried thus far. We want to help you find the imbalances in your body, both physical and emotional, and teach you and empower you how to fix them yourselves. And what I want to do is I want to bridge the gap and create a plan to see how we can best support your healing journey. How does that sound? Because here is what I have for you. But first, I want to cover, this is not for you if you are someone who has 0 time to invest in yourself and in your health. This is not for you if you want that magic pill or that quick fix to fix it all, because I'm here to tell you that recovery takes time and consistency. There are people who will try a couple things and miraculously they will feel better, and that's awesome. But for the most part, what I see is it typically takes 3 to 5 weeks for my clients to feel about 50% better, and about 8 weeks before they're 80 to 100% better. And they're given the tools so that should they have some type of flare-up in the future, they know exactly what to do to take care of it. Finally, this is not for you if you are not motivated to live a pain-free life again. So here's what I have for you. Here is how to get started. Number 1, I'm going to put a link right now in the comment section. So what I want you to do is I want you to click the link in the chat box below to set up a one-on-one strategy session call with me. And this is for people who I have not spoken with, who are obviously not current clients of mine. But if you're someone who's never worked with me, who we've never talked on a Zoom call, please click that link, set up a one-on-one call with me, because what we're going to do is we're going to have a one-on-one conversation and create a game plan to help you become pain-free. If you love the plan, we can move forward with a few different options that I'll be able to present to you on the call. And hopefully you will be able to be one of the 4,500 plus people, or actually an additional one of those 4,500 plus people that I've helped become pain-free. Does that sound fair? Guys, if getting pain-free is something you want, please click that link in the comment section below. Set up a one-on-one time with me. And let's get you on the road to recovery. Because are you ready to become pain-free? That is one thing that I can help most people do. And even if you have suffered for months, weeks, or even years, if you've tried 4 to 6 other treatment approaches and they have not worked, those are the people who typically find me as their last resort, and we get them on the road to recovery. I just want to say thanks for joining us tonight, and I'm looking forward to seeing as many of you as possible over the next 2 weeks.